Hi, welcome to 5 Surgical. My name is Alan Brown. I'm the Chief Medical Officer for Southeast Georgia Health System, and we are here visiting our new surgical floor that we were able to open up during the peak of COVID. It's a new floor, it's spacious, it's connected to our previous towers, the Glen Brunswick and St. Simon's Tower, and forms a contiguous hallway so you can access all 3 towers simultaneously. It also has its own elevator system and individual entrance as well for family members and employees and staff members. When the pandemic started, leadership shifted efforts and focused efforts on finishing this project as soon as possible in an effort to consolidate and create beds for the COVID patients, as it was the peak of the pandemic, and we were actually able to complete the project a few months ahead of schedule. And I'd like to introduce Cindy Rockhill, who is the nurse manager for 5 Surgical.
Welcome to 5 Surgical. We have 32 beds on this floor. The rooms are spacious. They have lots of light, a big window. We have 2 nursing stations. We are in close proximity to our new operating rooms, which is convenient for them to bring the patients back since we cater to a surgical population. We were very excited to open our new unit. This is one of the rooms that we've opened up.
The new rooms are very spacious for the patients and their families. A lot of room to move around in. Each room has a chair that rolls for the patient, as well as has a couch for visiting family members.
We've updated our call system, and with this call system, when the patient calls for a nurse or a CNA to come in, they will have locator badges, and they will walk in the door, and by the door there's a panel, and they're able to turn the call bell off when they walk in the door, and there's a light on the outside, and depending on what color the light is, you will know that there's a nurse or a CNA in the room, so you will know that the patient is being cared for. In the shower, there is a chair that folds down so the patient can sit down and take their shower. We don't have to worry about them falling, getting weak. There's also bars in there that they can hold on to for safety purposes.
As a physician, it's always good to see our patients mobilizing and getting up out of bed and sitting in the chair and moving about the room, getting closer to the things they would do when they return home. But the very modern design, which is nice, and large open window just makes the room really bright. It's just a better place to stay.